Welcome back. If you had to choose between having money, friends, or hair, what would it be?
You know my answer. I don't like drama. I want them all.
Exactly. Well, you know, a lot of people, I would want my hair, definitely.
Exactly. Most people would. And in a recent survey conducted by the International Society of Hair Restoration Surgery, it says that nearly 60% of people asked that very same question said that they would choose hair.
And Dr. Mike Vories of Carolina Hair Surgery is the expert in the field of hair restoration. Great to see you.
Yeah, welcome.
Good to see you guys.
You've been on Lowcountry Live several times, and I am amazed by the people you bring in because, one, they are completely changed after you meet with them. Because, tell us why, what you guys do.
Well, we do hair surgery. We take hair from the back, put it on top, and we do individual follicular units, so it's a very natural look. And when people see their hair come out, they get as excited as they are in terms of being worried about that study that showed that the hair loss is something that's very worrisome.
Now, how do you know when you are starting to run into a problem where you're losing your hair?
But, you know, people shed 100 hairs a day, and that's a normal. Brad Pitt loses 100 hairs a day, but the thing is he cycles in 100 hairs a day.
Right.
So there's no net hair loss. But where you have to look is on top. Are you noticing thinning on top? And I think that survey, you know, is kind of indicative of two things. I think there's a lot of people out there worried about their hair loss, and that hair loss means a lot to them.
Now, do you notice a lot of people, especially this time of the year, they go out in the sun and they say, wow, the top of my head's burned, and that's never happened before?
We see that sometimes. I think that what perks people up is they'll see a photo that they didn't know, you know, back of their head. Yeah. And then that's what, oh, I didn't know I had that much hair loss. I think that's what they see. But
you just don't do the surgery as well. You can meet people before some of this happens, correct? What are some of the medicines you guys do?
Well, it's true. I mean, my oldest daughter is now 18 years old. She has friends that I'm seeing lose their hair at that young of an age. You know, between 18 and 22, those college ages. Those are the kids that we really aren't thinking about surgery. What we're trying to do is stop their hair loss. And believe me, you know, I started losing hair when I was in my 20s. And if there was a way for me to stop the hair loss when I was that age, I would have busted a few extra tables to do it.
Exactly.
Well, and I'm sure if you stop it ahead of time, it's less expensive than it gets down the road, correct?
You bet. I mean, this is like fluoride and dentist. I mean, we're trying to do something that prevents the hair loss and maybe prevent hair surgery down the road.
No, and this just isn't for men, ladies. I mean, you see a lot of ladies as well.
We do. We see a lot of women for surgery. There is medication for women as well. But the medication that is currently out that is taken by mouth is approved for men.
Now, you brought a photo along with you, and you got some pretty good results there. How did you come to this result on the right-hand side?
Yeah. Wow.
Well, this is follicular unit transplant. This is taking a guy who has a bald spot. We all see this. And then we take hair from the back, put it into individual hair follicles under a microscope, and then place them all throughout here, and then wait about 3 months to 6 months.
That's it?
Bam.
And the way you place it, too, is the natural wave of his part as well, I noticed.
Yeah, we follow the existing hair angle. If you can, I don't know how close the camera can see this, but he's got existing hair here.
Right.
Yeah, we just follow that hair angle. And as we follow the hair angle, it fills in.
That is unbelievable.
Now, how many have you done over the last 5 years?
Oh, we've hit the 500 mark in Charleston. So
and you have people from all over the nation that
all over the nation. We've had people from China fly into Charleston for hair surgery, believe it or not.
So how do they contact you?
Usually it's the internet.
Okay.
You know, realhairrealfast.com, and bam, there's our website right in Mount Pleasant.
And you've got a special going on, right?
Yeah. Summertime, we always go down about 20% on our pricing because it's our slow season.
Right.
Before Labor Day. Usually in September, it picks right back up with the school season.
So they can go as low as $2,995, which you look at it and you say, oh, that's a lot, but guess what? Imagine what you're going to pay for medication and things like that, and if it makes you happy in the end, that's what it's
imagine the
about.
Confidence and earning potential you have afterwards.
Exactly. Yeah. Well, good to see you.
Yeah,
well, thanks again
so much. Good to see you.
I've met several people that he has done that way.
And look great.
They're amazed, and their self-confidence is amazing.
Well, stay with us, find out how you can help feed the hungry without even leaving your neighborhood. East Cooper Community Outreach has the details next.